come to a very important session of this 3-day virtual conclave. This session is all about building resilient and sustainable healthcare infrastructure. And we all know how much importance resilience and sustainability will be playing in the new world order when we talk about healthcare infrastructure. And for that, we have eminent speakers with us. Let me introduce to all of you. We have with us Mr. Mukesh Sabarwal, CEO, Asian Heart Institute and Research Center. We welcome Mr. Mukesh. Thank you so much for joining us today.
Namaskar. Namaskar.
We're joined by Joy Chakraborty, COO, PD Hinduja National Hospital and Medical Research Center. We welcome Joy Chakraborty. Thank you so much for joining us today.
Good evening and thank you.
We welcome Colonel Dr. Sunil Kumar Rao, CEO, Gujarat Cancer Society. We welcome Dr. Rao. Thank you so much for joining us today.
Thank you. Thank you very much.
We're also joined by Dr. Prabhu Vinayagam, Group CEO, Mandala Group of Hospitals. We welcome Dr. Vinayagam.
Thank you.
We're joined by Mr. Prashun P. Chatterjee, CEO, Name Care Hospitals Private Limited. We welcome Mr. Prashun. Thank you so much for joining us today. We're also joined by Suparna Sengupta, CEO, Narayan Memorial Hospital. Thank you so much, Suparna, for joining us today.
Hello, thank you.
And we're also joined by Mr. Samir Mehta, Vice Chairman, Dr. Mehta's Multi-Specialty Hospital. We welcome Mr. San. Thank you so much for joining us today. So with this, we can start the session. The name of this session is Building Resilient and Sustainable Healthcare Infrastructure. We all know that resilience and sustainability in the context of global health may not be a phrase that trips easily off the tongue. Yet the COVID-19 pandemic has thrust this critical issue to the forefront of our collective minds in the pursuit towards access to healthcare for all. The new WHO guidance for climate resilient and environmentally sustainable healthcare facilities provides health professionals and healthcare facility managers with key tools and interventions to strengthen healthcare facilities in the context of climate change. The aim is to enable healthcare facilities to anticipate, respond to, recover from, and adapt to climate-related shocks and stresses while minimizing negative impacts on the environment and leveraging opportunities to restore and improve it. The world is waking up to the need for a transformative shift to ensure a sustainable and resilient healthcare infrastructure for the future. And who better than the leaders from the healthcare fraternity who will join us today for this session can talk about this subject. So let me ask the question to Mr. Mukesh Sabarwal. In fact, I will be asking the same question to all of you in the first round. That is, do you think that pandemic has shifted our focus to build a resilient and sustainable healthcare ecosystem more than ever? Your thoughts on that, Mukesh Sabarwal?
Yes, very true. Because earlier, never anyone thought that healthcare business will go down. Everyone thought healthcare business will keep on growing. Once we have opened the hospital, keep on growing. And during the first wave, it caught us, everyone, in a while and said, what to do. If you take a COVID patient inside, the government will come and shut down your hospital. And how to protect yourself, because the behavior of the organizations, the government was very different. People were not prepared. And first wave, majority of the hospital made losses because they were not prepared for the wave. And they practically either shut down the hospital or they were not allowed to take COVID patients. Normal patients stopped coming to the hospital. Protocols went so high. So every hospital faced a lot of their staffs, employees. In the first wave, everyone got exposed. And no one knew how to handle this COVID patient. There was no protocols and all. So majority of the hospitals in the first wave faced severe losses. And quite some of them closed down also. But then people thought, what to do? The second wave was not there. The first wave went off. All hospitals started coming back. I had been in two hospitals during COVID first wave and second wave. In the first wave, I was in the Apollo Hospital, where the organization was very proactive and was taking lead forefront in the testing as well as setting up protocols, norms and all. The process was very, very strong. And even they opened the hotels, they took over the hotels for isolation. And Apollo was the first one who started treating the patients of COVID in private hospital. But then the government norm came ki you cannot charge more than 10,000 rupees, and there was a capping which is not. So it was very, very difficult to sustain at that cost if you want to do it in the right manner as per the guidelines. You can't make money as per the guidelines of the government. So very, very difficult for everyone to survive during that time. But the number of patients were there, and the major fact is that the fixed costs you can't control. Your electricity, your other thing. The only thing which remains with you is the manpower. How efficiently you manage your manpower during this time. Cost cutting was the only option with the organizations to stay alive, because there was no set rule. We had exposure in one of our two hospitals where one patient just entered the hospital and it was detected, and government had locked down that hospital for 21 days. And we had to quarantine all our 100 staff into a hotel, which again was an extra cost. So first wave, no one knew what was there, but as everyone knows, we learn from our mistakes, and all these people evaluated how cost can be controlled. Cost was one major factor which came into this, and all hospitals took major action in cutting costs, which they would have never thought during the normal course. Right from manpower, electricity, any flap which was there in the organization, all leading hospitals cut it out because they are very top heavy, and they started learning how to do more with less staff, extended duties, and I would like to kind of salute the housekeeping staff, the nursing staff, which really slogged very hard during that time. We salute to those uh, fighters, the doctors, and they have really risen over and above of their duty and delivered the results which were there. That is why the first wave got controlled very quickly and lived. It was very. The second wave, people were prepared. They started preparing out. They knew how to kind of treat patients. In the second wave, the hospitals made good money. Though the restriction was there from the government on this thing, but still, apart from that, all hospitals and with vaccination also made good decent amount of earning to survive. So it is very, very important for everyone to now continue the same way. We don't know how the wave will come in future. The third wave seems to be slightly approaching. We have to be more. The second wave, I was in Asian Heart Institute where I did, but they were not treating COVID hospital. It was a very difficult situation on a call to take in the cardiac hospital, which does purely cardiac surgeries. We should take COVID patient or we should not take COVID patient. So when we did the entire homework of preparation, ki whether we take COVID makes sense or not, so we ultimately decided not to take COVID patient because all the cardiac patient will move out and we'll be left with only COVID hospital, and we'll never able to come back with the cardiac patient because we were taking very high profile cardiac patients in the institute and very severe and compromised patients during that time. Though we were making heavy losses, we decided not to start COVID, but keep a entirely COVID-free environment. The few of the hospital would should remain non-COVID, where the patient can come and have the comfort that they will not get infected. But losses were very, very high. But once the COVID subsided, with the cost control and with the minimum manpower, we rebounded back. We
Right.
doubled our business as soon as the second wave struck down. And glad to say that within 2 months again, we were back to EBITDA positive situation. And vaccination also, we made decent amount of money during that time. So
Right.
future is very, very clear. Be very control cost. Cost control is very, very important in healthcare.
Right, right. Thank you for this insight, Mr. Mukesh. I'll come back to you. It's like to be or not to be situation that whether we go ahead with COVID patients or don't. But I think that has been one of the greatest learning. I think we'll ask that question in the second round of the discussion, that what has been the greatest learning out of this pandemic when you talk about hospital infrastructure. But I'm sure that others will also chip in with their point of view. Let's have a perspective from Mr. Sameer Mehta, Vice Chairman, Dr. Mehta's Multi-Specialty Hospital. Mr. Mehta, Sameer Mehta, your thoughts on that? Do you really think that pandemic has shifted focus to all of us, be it hospital, be it healthcare professionals, be it government thinking of hospital healthcare, that we have to now build a resilient and sustainable healthcare ecosystem because we don't know what will be there in future. Your thoughts on that, Mr. Sameer?
Thank you, Suvik. So I think a lot of the thoughts have already been voiced. The hard reality is great systems are built for resiliency, for growth, and typically for profitability, or at least sustainability, right? And these are slightly different indicators. There's also customer touch. For the longest time, I think our hospitals were focused around customer first kind of models, where we were perhaps growing, trying to help customers and customer touch become a little bit more holistic around things like preventative. We'd started investing in telemedicine. We'd started investing in the Internet of Things, our facilities, more waiting rooms and the like. And what we learned during COVID is a lot of those got shifted topsy-turvy. We were a little bit lucky because during the Chennai floods a couple of years ago, we had a great early warning of what a crisis can do to a hospital system. If you don't have resilient, and when I mean resilient, I mean flexible supply chains. So supply chains that come from two different sides of the city. Because if you obviously get water flooding your main supply route, you don't get oxygen, you don't get your critical supplies. Clearly, I think all hospitals have to perhaps move from a growth mindset to perhaps a sustainability mindset. And I think it's not just the corporate folks that got an early warning. The government institutes got it. I think most of us know that the amount of GDP that's been spent on healthcare has gone up disproportionately during COVID because the government really, I think, did a fair job to catch up a little bit more on previous underfunding to that to our industry to a large extent. But I think let's come back and focus on a few simple things. The first is, I think most of us did not predict how badly our supply chains would be disrupted. And I think the resilience around making sure that the wholesaler would not prioritize hospital A versus hospital B, I think was a major wake-up call. We know about some of the corporate hospitals in parts of the country which basically got the entire supply of remdesivir because they just put that much money on the table. Or they said they would cut off that wholesaler in permanence. And those were things that we'd never have assumed we'd ever see, right? We'd never think that we would be fighting to a hospital that's 5 kilometers, that's a corporate publicly listed company for things like basic resources. That's one. I think the second thing we learned very hard is that your staff, even the committed team members, have heavy irrationality when it comes to personal safety and when it comes to family, what I think communications and word of mouth. The number of our nurse families that yanked their nurses and duty doctors off our rosters, at least in the first wave at the start, because you had all this disruption, was something that we had not predicted quite so strong. So making sure you have a little bit of redundancy in that system, you had flexibility that you could provide, for example, emergency stay. You could allow a few more people to stay nearby the site because if they left the site, you don't know if they came back. If you allowed them on holiday, you definitely didn't know they were allowed to come back because states shut borders, right? You had a problem between two districts in the same state. So I think that was our second big learning in terms of human restrictions. And I think the third one was actually a more profound one, which is a fundamental reality of these times is it's important to band together. So I think folks like Joy, we've been spending a lot more time together as part of AHPI, the Association of Healthcare Providers of India, as part of CAHO, the Consortium of Accredited Hospital Organization of India, and other bodies like CII, FICCI, so that we had a defense against an irrational government, right? The government, because of pressure, tends to do what is the easiest thing to understand. sometimes. And it wasn't, not all the areas that they intervened into were for the benefit of either consumer or for the institute. Like, I'll give you a simple example. In Tamil Nadu, the moment the government said we have price caps on private hospitals, we lost 1,000 to 2,000 beds from the private hospital system to look after COVID patients at the peak of COVID wave 1. Right? The government should put policy and regulate policy and then punish punishers who do not live into policy. So if you have a rule about what you should allow into a hospital, what you shouldn't allow into the hospital, I think those are fair rules to do once you've thought it through. But when you make rules on the fly, then it's not a simple thing, because you are actually directly impacting the lives, and in this case, the lives and deaths of many millions of people. So I think we were, to a large extent, we learned hard. By being together, we learned a lot. We learned about vaccine programs. We learned about which vaccines we should take investments on. I mean, the HPI Tamil Nadu guys really rolled out and got some 300,000 vaccinations for all the small hospitals across the country, and especially across Tamil Nadu, because those were the guys not getting vaccines, right? At the early days, once the government ran out of vaccines, how were we able to get vaccines, and how were we able to talk to the government that, look, you need to save vaccines not just for day 0, but also day 1, day 2, day 3, day 4, because not everyone's going to come on day 0. And if everyone comes on day 0, everyone's spreading COVID to everybody else. So I think resiliency for us moved the needle from into areas like flexibility, into areas like sustainability in a much more profound manner. And let's be honest, all of us took haircuts in terms of how much we paid ourselves, our staff, and our loved ones, because at the end of the day, you look after this business so that you can serve our customer. And we were really hard pushed during COVID wave and wave 2.
Without any doubt, without any doubt. But if I take a crux of what you said, that I think the biggest learning or biggest experience of this pandemic for hospital infrastructure is that we have to shift our focus from growth mindset to sustainable mindset, and also ensuring a flexible supply chain. And I think technology has played a very important part in the solving those supply chain, and maybe good days are ahead also. I'll come back to you, Sam, but before that, let's have a perspective from your good friend, Joy Chakraborty, COO, PD, Hindu National Hospital Medical Research Center. Mr. Joy, your thoughts on this, that what you think when you talk about the resilience and sustainability for the hospital infrastructure?
So first of all, thank you for inviting me, and it is little difficult to talk after my dear friend, Samir, when he gives a lot of jargons and heavily loaded statement. So I feel the sustainability, and in terms of what you talk about growth, I feel over a period of time, the healthcare sector, was becoming little bit not challenged, and we are growing the way we want it to. This is a time when probably we faced an unprecedented challenge, and what has taught us a lot of lessons. Why I say so? Because during this time, probably when we talk about haircut, we talk about cost cutting and all, probably this is the thing which has targeted all sorts of providers, irrespective of it is private and government, to understand where do you stand in terms of your cost, where do you stand in terms of your strength, resilience to manage a situation. I'll give we read a book a few years back, Jugaad Innovation, and the same author, Jaideep Prabhu, he wrote a book that doing more with less. So I take the example of that, and I try to apply that in the healthcare today. When we say that, are we going to be sustainable in coming days? I'm quite sure everyone who has taken the right step, who has taken the right decision, they are going to work and they are going to sustain. They are not going to perish. However, there will be few setups, few hospitals, few infrastructure who were probably not standing in the right foundation, they will find it extremely difficult to manage and sustain. When we have seen there are several occasions when things have come like wave to the healthcare sector. In terms of the business, we have reacted, responded, and slowly we have seen that has not remained anymore a challenge, and we have adapted in that changed environment. And I want to share some of these. Maybe those in terms of the magnitude will be much smaller than this COVID, but in terms of impact, I'm sure it has affected many of us in multiple forms. The first you think about, when the CGHA, ZSI, insurance scheme and all, they had a very lower reimbursement and they started curbing the hospital bill in terms of reimbursement, we reacted. When we see, when this the nationwide the scheme for the Pradhan Mantri Jan Arogya Yojana, when it came, PMKVY, at that time also we are not very comfortable and we are thinking how we are going to manage and sustain. And just before that, there were a lot of curtainings in terms of the prices of whether it is tent, it is medicine, it is many of these consumables. We were finding it extremely difficult that how do we sustain in that environment. But the good news is, even after all this, we have managed, we have sustained, and we have shown phenomenal growth. That is the best part of any business, that how do you react, respond, and come out from that situation. So my point will be that whether this infrastructure resilience is going to be there, whether we are going to come out, whether this business is going to be sustainable, I'm very hopeful that these are all the temporary ups and downs what a business we see. It is only we have to play our cards suitably at the right time. Because I can tell you the example what it was given just now, that in Tamil Nadu government came up with price control. I can tell you today, even in Maharashtra, there are 80% beds are reserved by the government at government price, and 20% beds, I'm talking about only COVID. And very importantly, the number of beds which are disclosed by the hospitals as COVID beds, as per government instruction, you cannot reduce these COVID beds even if you don't have adequate number of patients. And with this reduced tariff as well as reservation of beds, it become very difficult. In the month of May June 2020, we were all struggling and we are thinking how we are going to make it. But today, when we are in September 2021, I can tell you all these hospitals have find their ways and means to manage and sustain. So I'm quite sure these are all challenging times. We have probably come out from the worst, but with the suitable strategies and steps, we can do well and we can come back into our normal action.
Right, right. Interesting in the insight by Joy Chakraborty. As you have said, that maybe react and respond, that it is equivalent to resiliency for the new world order hospital infrastructure. And I'm thinking you're right when you said that we all have to find our own ways to move forward, and hospitals have also tried to cope up with unprecedented need in the time of unprecedented crisis. I'll come back to Joy Chakraborty. Let's have a perspective from Colonel Dr. Sunil Kumar Rao, CEO Gujarat Cancer Society. Dr. Rao, your thoughts on this?
Yeah, so I've been, listening to all my panelists, and they have brought out a lot of factors, especially on the financial resilience, I would say. Financial aspects have been very well covered in terms of whatever difficulties all of us faced during first wave and second wave. As the first panelist also brought out difference between first wave and second wave, and then followed by capping by the government, and how we came out of that by doing various methodologies. I would personally go on the path of resilience in terms of human resource, because that we found very, very difficult in terms of first wave, where we treated around 7,000 patients during first wave, and during second wave we have treated, being a cancer hospital also, we could treat around 3,500 patients in two of the hospitals. And there was the biggest challenge, I would say, from resilience point of view, was the human resource, which needs a particular amount of training. We also realized that the super specialists which are available, which we never thought earlier, could also be of use to us in terms of giving infectious disease like a COVID the same amount of efforts and same amount of duties, which in any case their other work was stopped, or rather their work had gone down. So that came very, very handy. Otherwise, the medical officers as well as clinical assistants, many of them, all of you are aware that they ran away due to family pressures, as brought out earlier by panelists, that even the nurses and the biggest people who were supporters were the housekeeping staff and these GDAs and other people who never gave up and stood by the hospitals all across. I have served during first wave. I have served in Maharashtra, where the situation was bad. Everybody knows, especially in Pune. We were running small hospitals, which needed again resilience from the point of view of the infrastructure also, because the bigger hospitals still can afford to devote a complete wing to one COVID area or cut off that area from others. But in a smaller hospitals which we were running, it was difficult, very difficult to create separate entrances, separate exits, donning areas, doffing areas, triage areas, and what have you. So many things, negative pressure operation theater, for labor room, separate labor room for COVID patients. Same difficulties we found during second wave also. From resilience point of view, we had to overcome all these difficulties, which of course causes financial aspects also in terms of utilization of your capex and subsequently to sustain that. One big thing which we realized is this, that if we do have in this country almost 12 lakhs of doctors, but how many of them are actually active? So from the resilience point of view, I think I would suggest, and we have suggested in various forums also, to have something like active directory of the doctors who are serving and are available on the job. Actually, Prime Minister also had appealed to the nation and to the doctors also from that point of view. But that, I think, is the biggest thing which we must learn through this pandemic, that if we have a current directory of the doctors, which Medical Council has, but it doesn't have like pharmacists. Like pharmacists have that active directory. Wherever you leave the job and go to another job, you must upload your credentials. Then only you can start the job there. That kind of thing, if it is available, then it would be really a boon for the human resource availability. As I said, the biggest achievement of this particular pandemic in terms of human resource was this, that all the super specialists who are available, like we say that around 1/3 of that strength, that is around 3 lakhs or so all over India, are available at the postgraduates. And also it includes the super postgraduates also. But all of them really came handy to survive through this. And probably now everybody has learned that they can also be utilized for such type of duties. And that definitely is a big gain as far as our country is concerned and the system is concerned. Apart from that, hospital infrastructure we'll talk about later as and when the questions come up. Thank you.
Right. Thanks, Colonel Dr. Sunil Kumar Rao. And you talked about the resilience in terms of human resource, and case of active doctors, whether we have got that data and how we utilize them. It also reminds me of taking cue from what you have said, that Ministry of Defense also had utilized the ex-servicemen doctors during to address this issue. Like you said, I'll come back to Dr. Sunil Kumar Rao. Let's have a perspective from Dr. Prabhu Vinayagam, Group CEO, Mandala Group of Hospitals. Dr. Prabhu, your thoughts on this?
Hi, good evening. Thank you very much for inviting me into this panel discussion with some of our esteemed colleagues. For me, yeah, so a lot of things have been discussed, but I want to put in the perspective that I was also the managing director of Joint Commission International before taking up this role in Singapore. And every time I used to come into the country, one of the most important things that we used to talk about in every conference and every discussions that I had with the CEOs of hospitals was the system called emergency preparedness. One of the most important things that I think our hospitals miss out is to be prepared for any kind of emergency. And that includes, and we used to talk about terrorist attacks at that time, because at that time there was an issue of terrorist attack. We used to talk about earthquakes. We used to talk about flash floods. And how many of us actually go back and do a proper drill in order to be ready for any eventuality? One of the learnings that I had from one of the CEOs from in Egypt was that they had done this pretty strongly and very well. And during the Egypt coup, that particular hospital was one of the best managed hospital, because they were able to do that because they had done this drill just before this particular coup happened. So I believe that for us, resilience should be that, we should be emergency preparedness programs in the hospital. That every year, at least twice, we should be able to do a drill so that we are able to ready to take care of all the issues. It's not only one issue. We talked about supply chain. The concept of supply chain in healthcare is that in order to improve our bottom line and in order to improve our efficiencies, we try to utilize the just-in-time model from Toyota. Just-in-time doesn't work in healthcare because we found the challenges during an epidemic, because that remdesivir is not available, steroids were not available. In Delhi, simple medicines were not available because of the utilization and because none of the hospitals did plan their supply chain properly. So that was one of the biggest learning that I think we did have. Somebody talked about human resources. Yes, human resources was a big challenge. And even though I've been an administrator for the last 20 years, I had to look at patients directly. 200 to 250 patients I saw during the particular period. And this particular infection or this particular epidemic, no doctors had any clue about how the treatment should be done. And I can say that being a doctor, because we were all doing hit and trial method, because we did not have a proper clinical protocol in place of how to manage a certain process. Yes, some hospitals did come up with a certain protocol of planning process. We said ivermectin is very important in the beginning, and then suddenly ivermectin is of no use, right? We said there are certain drugs are very important in the treatment management. Then we realized that that drug doesn't work. So there was not a proper planning of what drugs should be used, what clinical protocols should be implemented, how it should be implemented. And that's something is a great learning for us to take it from building a resilient organization. The third important aspect that I still find most people are not getting into is the utilization of technology. How are we using our data systems? Are we not only using our data systems? First of all, a lot of hospitals do not have systems in place. We do not know how to collect data. We do not know how to use the collected data and how to infer. Hospitals across the world are going into augmented reality and artificial intelligence in order to predict a certain disease or a certain disease process. I think we are a long way behind in that context. How do I use IT solutions to help improve my data systems? How do I collect data efficiently? And how do I utilize that collected data in order to have better positioning within the hospital and to manage? And when you start using data systems properly, you manage everything. You manage your supply chain, you manage your inventory, you manage your human resources. How do I spend more time in training? Again, as I said, this particular pandemic has opened up where even the class 4 employees and the lowest of people were able to provide help to the patient simply because of a certain level of training being imparted to them during the pandemic. And last but not the least, one of the other important things that has come out during this pandemic is an extreme confusion among people, among patients. Not only extreme confusion, but extreme false information and false reports. thanks to our social media, a lot of that has flown through it. How many of hospitals are going into a community response in systems? And how many hospitals have gone into the community and tried to help and provide an information within their area of operations? And that's something, again, I think is a learning for us, that we should be able to take it forward and involve more community practices. How do I go into, as a hospital unit, how do I go into a residential area and give the right information coming from a leading hospital from that territory? Makes a huge amount of difference, because the amount of false information floating in the social media is so large that people are further panicking, and that panic brings down the entire system down. So it's not only one or 2 points. There are multiple factors involved here that needs to be taken into account. And the question, and I'm going to be being the devil's advocate here in saying, are we moving ourselves to build a resilient and sustainable? I think we have a long way to go. I think all the hospitals, as us leading hospitals, should come together and start developing a plan that how would we look at in case another epidemic comes, and if it is not COVID. You learned a lot in the first episode of COVID. So therefore, we've been able to implement in the second wave of COVID. What about a wave of Nipah comes in? Or what about a wave of Ebola comes in? What are we going to do? We are again back to square one, trying to find out how do we handle that situation. COVID is currently practically manageable at this point in time. You may perhaps be able to manage the third wave also very effectively and efficiently. But if there is a new pandemic, how are we going to manage? And we're all back to square one. And I'm sorry to be negative about it, but I think this needs to be put on table, and certain thought process should be built around it of how can we be resilient and develop a complete different infrastructure for healthcare practice in India.
Very important point raised by Dr. Prabhu. But before I move to other speaker and take a view of what Dr. Prabhu said, let me ask him quite clearly, because I think everybody is eager to know. Are we now clear how to control this pandemic? Because you said everybody was clueless. Just on a lighter note, since you're a doctor, so are we now sure that how to treat COVID?
I will take it with a pinch of salt. I would still say clueless, but then I would at least say that we are able to manage the symptoms now much better.
Right. That was on a lighter note, but on a serious note, what you said, a very important point, that hospitals in India have to have an emergency preparedness program. At least twice a drill. A drill has to be there twice in a year, and also utilization of technology. You're saying there's still a gap, and also long way to go when we talk about healthcare resilience in India. Let's have a perspective from Mr. Prashun P. Chatterjee, CEO, Nemcare Hospitals Private Limited. Mr. Prashun, your thoughts on this?
Thank you very much for inviting me. My fellow panelists have covered almost everything. So I'll just highlight on two very important things. One was the human part of it, how we dealt with this total COVID thing. See, in every change, whenever there is a change, the change goes through 3 phases. First is the objection to the change, next is the skepticism, and third is acceptance to the change. And this COVID was also very similarly handled by the healthcare fraternity. Initially, there was a lot of panic. There was a lot of, question marks, which we overcome. And now we have come to a state where we have accepted it. If you compare how we handled the first wave and how we have handled the second wave, there's a drastic improvement in our approach. The first wave, we were clueless. We didn't know how to handle it. And the second wave was handled much more smartly, if not to the extent of the results that it has produced, but it was much better than the first wave, handling of first wave. So now I think we are getting more and more prepared for the third wave, fourth wave, or whatever, fifth or sixth wave. Because now we have learned to stay with COVID. We know that the we have to stay with COVID. And we have mentally prepared ourselves, learning-wise prepared ourselves, as well as we are more and more preparing ourselves. So there is the panic thing has gone off. Like initially when we had a panic, so now that thing has gone off. That is what my take is. Hats off to everybody who is into the healthcare fraternity. In the first phase, there was lesser involvement because of the fear factor and all. In the second phase, everybody jumped in to contribute. So that was again a good sign of how we are going through. So that's the first part of the human aspect, how we dealt with this particular COVID change. The second part is the technology aspect. Like now we need to more and more involve technology in terms of penetrating and reaching the patients virtually. So there was a lot of technology advancement which happened during this particular phase. We have learned something like virtual OPD. We started conducting virtual OPD. We started giving home care to the people who were home quarantined, through virtually communicating with them. And so that is going to be the future of healthcare, I suppose, because the habit of people are changing, and we also need to be prepared in terms of our delivery, how we can reach virtually to the patients without coming into physical contacts and treat them. So that's one very important part, which I see is going to open up a very big business foray for healthcare in future.
Right. Very important point raised by Mr. Prashun Chatterjee, that the most important part, what you have said about that, when you talk about change, there are 3 stages of change: is that objection, skepticism, and acceptance to that change. I think that has changed a little bit or drastically during the pandemic. The first wave, second wave have been a learning for that, and also there's no doubt that we have to use more and more technology, because that is the future. There's no denying that fact, and whoever denies that fact, I think they have to change their mindset. As you talk about changing mindset, Mr. Prashun, I'll come back to you. Let's have a perspective from Suparna Sengupta, CEO, Narayan Memorial Hospital. Suparna, your thoughts on this, that when we talk about building resilient and sustainable hospital infrastructure, are we still there or a long way to go?
Thanks, Shobik. I think I would definitely, all my fellow members are here. We are all, we have sailed through this time all together. But I would still feel that, are we really resilient yet? That's a big question. Is India really prepared? And why today we are in such a situation? Dr. Prabhu has mentioned some very, very pertinent points. Even I feel, because I've been with the healthcare industry for the last 25 years. It's almost going to be 26 years next month. So I feel, even I was like, everybody of us, whoever is sitting across the table today, is having experience of 25 to 26 years. So how can we do not know anything to do? How we were just fell apart and we were like struggling, absolutely. So how did it happen? Because we were not prepared. We don't know what to do. We are always very, very non-serious about healthcare. So this has been a very, very learning for me personally, I'll tell you. If I ever come across any such of situation, I know now how to prepare myself. So this has been a very, very hard way to learn. I think for all our healthcare leaders, whoever is sitting across, we should not feel bad about it. Yes, okay, we did not know, but I think we just waded through the situation. Sam had been very, very critical about, the things we had faced. But tell me, Sam, what did we do? We met so many times, we spoke, etc., etc. But what was the contribution from all of us? Like training, how to be like, more proactive. What about the manpower issues? How to see that the total retraction of doctors for treating the patients. Didn't we all face it in the beginning of the first wave? What happened to those chronic ill patients? I lost 2 of my family members who were doing relatively well in cancer treatments, just succumbed to COVID. Why? Because they could not go to chemo, they could not do this, they could not do that. The hospitals were shut down. What is this? So what happens to the preventive management of healthcare? What happened to all of us? So it's like a question to all my friends out here, that Isn't it a very, like, don't you think that we need a training first, like how to run it? I mean, that's a very, very hard way to learn. And yes, the government would have been definitely warned us. And I think it's a long, long way to go, Shobik, I still feel. So it's more to the aspects of my personal feeling is, what happens, what is the preventive healthcare management system in India? What happens? Why we are so reluctant to take it by the bull by the horn? Why, what are we exactly doing on that part? What happened to numerous diabetic patients, numerous kidney patients, numerous oncology patients? What happened to them during this time of pandemic? How did we treat them? So virtual treatments, like Proshun was mentioning, virtual treatments, creating e-platforms, going home, taking the care to the doorstep of the patients, why were we like hesitating for all these years to do all these things? Because I think we were not, given that, given that view, the panoramic view, like, this is what healthcare should be. So I think that's where we all lacked, and we all landed up in this kind of a situation. So Dr. Prabhu's, I'm absolutely with him. I think we need more training. We need more exposures, this kind of things, to how to handle them in future. And see, preventive healthcare is a very dear subject to me. So I think if we would have been more, towards it, from day one, so a lot of, eventualities could have been avoided. And it's technology, healthcare. We are now talking about AIs and all this. What about the basic? Why were we hesitant about embracing technologies? What was this virtual consultations not happening few years back? What stopped us? Why did we not do this? I think we all lacked that perspective. We all lacked. We never practiced it. We never did that. We always believed, yeah, आपको अगर दिखाना है डॉक्टर तो आपको हॉस्पिटल चल के जाना है. The hospital has to be, you have to go to a hospital to get your medicine. You have to go to a hospital to see a doctor. So I think we did not do all this. We were like not doing it. So I think this all happened. And one biggest sore point, I joined a new hospital at the time of pandemic. So it was a humongous task in front of me to get the manpower first. Who will treat my patients? So getting the manpower, or, making them feel comfortable, safe, their families safe was a huge, huge challenge. And as Mr. Sam was mentioning, that this is one of the biggest issue we all face all the time whenever we run a hospital. That is a huge attrition of people. So here also, it was no different. It was COVID, non-COVID, huge amount of technicians and attrition of nurses are quite rampant in this country. So COVID did not see any difference. More or less, it was aggravated. So I think proper counseling, proper, places, to make them feel comfortable, to give some kind of emotional, social, and mental support. And we are with them. I think it is something we all, as a healthcare leader, need to cultivate in the near future. And supply chain, of course. Now, we were asked that you cannot charge more than 500 rupees for a doctor. You cannot charge more than 1,000 rupees for a bed. So what happens when we are buying something? Why there is no ceiling? Why anybody can charge anything? Now, which hospital can put in the lot of money, they will get the supply first. Why this kind of things are happening? So if we can have this kind of leverage for bed charges, doctor's charges, and hospital investigation charges, why can't we have it for the other side of the table? So what did we do about it? So there are a lot of questions, it keeps on popping up. I think whether it is first wave, second wave, third wave, or, no matter what kind of disasters we are going to face in the future, because this is something at least we never had seen. All of us sitting here, we never thought that we will be landing up in such a situation. And it's such an abrupt way, losing so many lives. And, very disheartening. And I think we should be more prepared and let us know. I would request all the big forums of the country to come together and give us a platform where we as healthcare leaders of the future can get ourselves more acquainted, trained, exposed, like how to manage a disaster or a pandemic at this level.
Very important, very important point by Suparna Sen Gupta, CEO Narayan Memorial Hospital, that how we have landed up here. How did we land in this situation? Because we have never seen this kind of crisis in our life. And as you said, that Dr. Prabhu was saying that it's time that we have an emergency preparedness program ready, because as someone also saying that we never know, it's maybe the third wave, the fourth wave, or maybe some other virus, because WHO has also warned that world should be prepared for more viruses and pandemic like this. And I think, but we should also see the light at the end of the tunnel. I think this has at least helped India to leapfrog in the healthcare advancement. What has not been done in last 10 years has been done in last 1.5 years. I think that's also a good side, but these challenges have to be addressed. We can take a example of Dutch city Amsterdam, because if the 1973 oil crisis would not have happened, or almost 4,000 people have not died, children have not died in Amsterdam, Amsterdam would not have become a cycling capital of the world. So that has been a lesson for all of us. I think that can be also followed. But let's hope for the best. But before that, let's take a quick perspective from all of us here before we end this session. A minute or so to all of you. Let's start with Joy Chakraborty. Mr. Joy, your thoughts. Where do you see the future? Is India ready for the future kind of pandemic? If not, what needs to be done? Quickly, in 40 seconds to 1 minute.
So I can't predict that when the next pandemic is going to come and what kind of nature it will have, because even for this nobody was prepared. But I can only tell that if it comes very quickly, if it happens in next few years, probably the system is going to work little better than the way we have responded now. But most importantly, I will suggest, and I feel that this lesson should teach us to create ourselves for a better prepared for any disaster, any sorts of pandemic, any eventualities. And that preparation probably, because I think this is almost considered as equivalent to Spanish flu of 1918. So from there, after 100 years when it has come, this is the response. But our inbuilt system should prevent us to get this kind of fatalities, this kind of negative impact on us in coming days, only when we create the robot system. And I'm sure this lesson will teach us to develop that.
Right. Thank you so much, Joy Chakraborty, CEO, PD Hinduja Hospital. Let's have a quick perspective from Mr. Mukesh Sabarwal. Mr. Mukesh, your thoughts on that? Quickly, in 30 seconds.
I think, everyone had lost their close relatives in second wave, and people forget things very fast. If you see now condition, no one is wearing mask, sanitization is gone, social distancing has abolished. So this will come again, and the situation is so bad, we don't remember things which are bad. We only remember things which are good. So, but vaccination has really helped. Vaccination is important, sanitization is important, and social distancing is important for future. Mask is most important, which people have learned, but people leave it very fast. So continuous education and training is the only thing. And mental health of the medical team is where the psychological treatment or continuous psychological counseling of the medical staff, nursing, paramedical, doctors is very important, because their mental health is very poor at this moment. In third wave, the biggest hit people will be the medical fraternity people, whose mental health has been very low now, because they have worked endlessly for hours and they have lost their mental balance.
Right.
So hopefully the third wave doesn't come in. That is what we should hope. And vaccination is over by all the time.
Let's hope for the best. Let's have a perspective quickly from Samir Mehta. Your thoughts?
Yeah, I think we will rise to the challenge, right? This is India. We are the Jugaad nation with a billion plus people, bloody young people, bloody senior citizens. We'll figure it out, right? But it will be a little bit painful. It depends whether we've really internalized and systematized many of our learnings. Simple things like EICUs, like connected wards, simple things like how do you provide mental health. I mean, we've rented out these cottages by the beach for some of our nurses and doctors to take a few days out, right? And that was a learning we got from another hospital in another part of the country. So I think it's internalizing many of these small things. And I think the third is, don't ever underestimate human power, but don't also underestimate the bullshit of government politics to sometimes make people do things that they shouldn't be doing naturally. I think our government has come a long way positively. And I think we're fortunate to have a forward-thinking government most of the time. But some of the time, especially when we have stress, they also have stress. For me, one of our big learnings we'd like to see is if they start showing the budgets and how much the cost per treatment for government hospitals and comparing it to many of the private, we'll start seeing where we can start plugging leakages in the system. And I think at the end of the day, humans, all of us have to take our own ownership for our own health. I'm not very happy to see that preventative health goes up and down based on when people have crisis and when they don't have crisis. And I think unless you take ownership of the most important asset in your life, the loved ones around you, or your health, do annual health checkups, go to good hospitals, go to reputed clinicians and practitioners, you're not going to solve long-term problems. So I think those are just small ingredients. Internalize it, make sure that we continue to keep trying and don't give up. And I think third, make sure that when we have a chance to breathe deeply, but then come back and systemize it again.
Right. Thank you so much. So that was Samir Mehta, Vice Chairman, Dr. Mehta's Multi-Specialty Hospital. Dr. Sunil Rao, quickly.
Yeah.
Future for you.
Yes. We will definitely come out of it and we will be doing better. I am from armed forces and ex-army people. We have a tradition of working very hard in peacetime so that we can produce result during wartime. So the same is true for our nation also. But only thing is that it has to be sustained. The efforts have to be sustained. Like government has already come out with third wave preparation. I am also part of it. Being Gujarat government institutions also coming under us. So this is one small portion which I wanted to mention. Like through army also, DRDO has done the efforts to make separate hospitals. So that kind of efforts which are there towards in a comprehensive manner in terms of manpower development, in terms of infrastructure development, if they continue, probably that would help us with whatever wave it is. It may be, as somebody mentioned, different types of viruses, different types of organisms will come up, and we would succeed definitely. And as a young nation, as Mr. Sam also mentioned, we can overcome any of the difficulties which we face.
Thank you so much. Thank you so much, Dr. Sunil Rao. We shall overcome.
Yes.
Let's have a perspective from Dr. Prabhu Vinayagam. Dr. Prabhu, your thoughts? Future is as bleak as what we are thinking? Can you unmute your mic, please?
Oh, future has never been bleak. It has always progressed well. So that's definitely not the issue that we're going to face. Let me quickly put down. So while healthcare needs to improve in various factors, and perhaps one panel discussion is not enough to do that, I will focus on how to look at what is the future for the next pandemic to look at it. So one of the first and foremost thing that I said was prepare for unexpected increases in demand of service. How do we prepare for that? Second is maintain line of sight. As Mr. Mehta said, look at ICUs. Let's look at connected wards and stuff like that, because help you to have a line of sight. And one of the most important in spreading of a pandemic is minding the air. We'll have to start relook and rethink about how the air circulation within the hospital infrastructure is. Installing HVAC system is perhaps not the only answer. There are multiple other facets involved in looking at the circulating air. Hand hygiene. We always been in my hospital. I was looking at my hand hygiene compliance. It never increased above 60%. I was really worried, and I asked the infection control nurse, what about the hand hygiene? Why is it not increasing above 60%. And the immediate answer was, sir, the nurses, there is so much of attrition. There are new nurses coming in, there are old nurses going out, and every time you have to train them on hand hygiene. When did healthcare professionals need training on hand hygiene? That's the first foremost thing that we learn. You don't have to keep training. So it's not a matter of training, it's a matter of habit. And then we dissected the data and we find that the nurses' compliance was 80% and the doctors' compliance was 30%. So that's
very true.
The challenge. So we need to look at that, and we as doctors should be proactively involved in reducing that. And last but not the least, use technology. Enough technology is available. I don't know why we are afraid of using technology in reducing so much of problems that we face. And most importantly, let's take mental health seriously. We've been talking about mental health all through, but we have never done anything about mental health till date. Government is talking about it, various forums are talking about it, but we have done nothing practically to help mental health, develop furthermore into a system, and let's take that seriously. Thank you very much for giving me the opportunity to come and speak with all this.
Thank you so much, Dr. Prabhu, for your insights. I'm sure it has been of utmost importance for all the viewers who is watching this panel discussion. Quickly, Mr. Prasoon Chatterjee, your thoughts on the future?
Yeah, I'm very positive that this will pass by. COVID will be something like another flu or influenza in future. Medicines will be available over the counter. So this is going to pass by. We are waiting for the next challenge, what is going to come. And human being is such a race, like, I don't think so. The world is going to finish so fast. So we are going to find out ways to survive.
Survival of the fittest. I'm sure human race will survive, being the fittest among others, and they will also win over the next course of pandemic if ever comes that. Let's hope for that. And Suparna Sengupta, your thoughts on that?
Just 2 pointers. First one is definitely with Mr. Sam, we will fight back and India will win and we are going to bounce back. So definitely, and already we are halfway. I'm very, very confident. Whatever learning has been done, we are progressing, and I'm sure it is not going to be the same again. Number 2 is preventive health checkup should not take preventive healthcare should not take a backseat. We have to bring it, actually we have to fast forward it and embracing technology. 3 points, that's it.
Right. So if I may take a crux of whatever has been discussed for last 1.5 hours, that the future, no one is denying that we have to build a resilient, sustainable healthcare infrastructure. And the future lies in 2-3 points. One, there have to be emergency preparedness programs in hospitals, optimal use of human resource, mental health has to be given utmost importance, technology, no shying away from technology, because end of the day, technology is a game changer. We have to use technology. And also preventive healthcare, that has to be taken into consideration. And if we can bind all these silos together, I'm sure we can build up a resilient, sustainable healthcare ecosystem, which can be ready to face any challenge in the future. On this note, let me finish this session. Thank you so much, Mukesh Savarwal, Suparna Sengupta, Dr. Prabhu Vinayagam, Dr. Sunil Rao, Prasoon Chatterjee, Sam Mehta, and Joy Chakraborty for joining us today for this very important session of the second day of second edition of APEC Health and Innovation Conclave, in which we are discussing on various aspects of healthcare infrastructure. Before I end this session, as Dr. V.K. Saraswat was speaking yesterday in his inaugural speech, he said that let us all be ready for Health 4.0. That will be the future. Thank you so much for joining us today for the session on building resilient, sustainable healthcare infrastructure. Thank you so much. Take care. Goodbye.
Thank you very much.
Thank you, everyone. Thank you, Savarwal.
Thank you.